Thank you all for joining us this evening. My name is Ali Kowalski. I am the programs coordinator at the Sacramento History Museum. And thank you for joining us for the first evening of our Cholera to COVID series. And tonight we'll be discussing gold rush medicine. If you have any questions during the presentation this evening, please enter them into the Q&A or into the chat, and we can address them at the end of the talk. Tonight's event will be led by Dr. Bob LaPerriere. Dr. Bob is a retired dermatologist and the curator of the Sierra Sacramento Valley Medical Society Museum of Medical History. He's a longtime board member of the Sacramento History Alliance, a bit of an expert on medical history and on the historic city cemetery, and I, for one, look forward to hearing his thoughts on gold rush medicine. Dr. Bob?
Welcome. And please do save up questions. I will try at least to answer them at the end. The beginning of medical history in Sacramento really started around the gold rush, January 24th, 1848. James Marshall saw something shiny in Sutter Creek near Coloma, and he discovered gold while overseeing construction. So began the influx of thousands of gold seekers to a new and rugged frontier with no infrastructure to cope with such a crowd, no public health measures, a region described by a first comer as one of the most healthful territories in the continent, with a climate unrivaled in purity and equability, nor is sickness, that scourge of humanity, here to harass and hinder us in our pursuits. But with no public health measures and minimal hygiene, within a few short months, the gold rush immigration produced a collecting point of health tragedy not to be equal to any other place in the world. Doctors did arrive with the gold rush, many in the hopes to find gold themselves, but more likely to find disease and suffering and be stimulated and challenged to resume their dedication to the practice of medicine. First Medical Society, 1850, the Medical Surgical Association, that's the English spelling for surgical. Next, in 1855, the Sacramento Medical Society formed. 1856, the California State Medical Society, which was the beginning of California's organized medicine and healthcare. 1858, the County Pathological Society. And there was a notation in 98 about the Sacramento Valley Medical Society, which I'm not sure what that relates to. By 1863, the Sacramento Medical Surgical Association, the Sacramento Medical Society, and the Sacramento County Pathological Society had all disappeared. But by 1868, the physicians had gained a lot of knowledge and organization, and many of those involved in the former organizations formed the Sacramento Society for Medical Improvement, which later became the Sacramento El Dorado Medical Society, and now is the Sierra Sacramento Valley Medical Society, known as SSVMS, representing the counties of Sacramento, El Dorado, and Yolo. 2018 was the 150th anniversary of SSVMS. It has been in continuous operation now for 152 years, and it's the oldest county medical society in California based in continuous years of existence. Normally, we're open 9 to 4 Monday through Friday, but unfortunately, due to COVID, we're closed until probably well into next year. Well, the 19th century was an era of treating the patient, which was the only option, as the cause of most disorders was not understood, and therefore one could not treat the disease as is now done. Therefore, the benefit of the physician in many diseases was questionable. As this was an era before immunizations, childhood diseases were a tragedy, and numerous children never made it past 2 or 3 years old. Now, talk about being sick and medical treatment in the 1800s. A beautiful description of early medical practice is found in the following letter written in 1825. The original letter, which you see here, was presented to me by one of my patients and was a letter from one of her relatives to another relative, again in 1825. On the 6th of September, I was seriously attacked with a bilious fever, also threatened with a dropsy. My physician thought it impossible for me to bear a run of the fever. He commenced breaking it on Sunday by bleeding and puking, which was continued on Monday. I was partially deranged on Sunday, which was followed by a state of mental madness caused by excruciating pain about the crown of my head, of the most agonizing torture that experience could conceive or tongue describe. I had my head shaved and blistered, one also upon my neck, upon my back, upon my bowels, one upon each arm, one upon each leg, 8 in number, all sort of time, very large and inflamed. Yet the chief evidence I have of the existence is the scars upon my body. A partial derangement succeeded madness. 3 months are lost to me. Time appears like an almost forgotten dream. I must turn from the subject. The recollection of it chills my blood. I view this affliction as a punishment for an abuse of reason. My nerves are still irritable and my health is tolerably good. Well, this was an era, again, of treating the patient, which was the only option because the cause of diseases was generally not understood, and therefore you could not treat the disease as we do today. Now, the doctor's bag was kind of the trademark of the physician for a long time through the mid-1900s until the ways of making a diagnosis would not fit into the doctor's bag anymore. The regular physicians in the gold rush era were also known as allopaths, and they learned medicine both through medical schools and through preceptorships, working with the physician for several years until they felt they had learned enough to open their own practice. Now, one of the reasons for the formation of our medical society was to protect the public from the irregular physicians. The allopath, as I mentioned, is what we'd think of as a regular MD today. There were the Chinese doctors and herbalists that served the Chinese community very well, and also the Caucasian community, as you'll hear later. And then we have the irregular physicians, and those are the ones that the Med Society was formed to protect the public from. The impositors basically were the least related and probably totally unrelated to medicine. And they would encompass people like hospital maintenance men and janitors that worked in hospitals in the Southeast that came to California, thought they had learned enough working in a hospital and set up a shingle and an office to bring in some money taking care of people. We have the eclectic physicians, which basically kind of utilized what was best from all the other fields of medicine at the time. Homeopathic physicians practiced, of course, homeopathy, which is still practiced today. If you go into most health food stores, you'll see a homeopathic rack of pills, and homeopathy based the fact that if you gave a patient a very minute amount of the same agent that would cause the symptoms of the disease, it would allegedly cure him. There were Thomsonians who believed in herbal medicine, and we had the hydropaths, which of course believed in profuse water internally and externally as a cure for disease. Now, interesting name for our Sacramento hydropath, Lavina Waterhouse. She ran the Sacramento Water Cure Institute, which, as well as I've been able to tell, was pretty much where the Sacramento History Museum is today. Now, the irregulars often had a large following because the use of cupping, bleeding, puking, and purging was minimal. One of the more touching images of the era of the time was called The Doctor. And as you can see here, it was painted by a painter that experienced the death of his 1-year-old son from typhoid fever on a Christmas morning. And this is the image we're referring to. Now, of course, in the training of medicine, anatomy was very important. The two images to the right are basically images that are in our museum by Bonavera from the 1600s. The image to the left is from Andreas Vesalius, a Flemish anatomist and physician, and often referred to as a founder, excuse me, of modern human anatomy. You'll notice a similarity between that and the middle picture. Bonavera re-engraved all of Vesalius's images, but he re-engraved them, flipping them 180 degrees. There were a lot of impressive artists in the 1800s that created the anatomy books of the time, and these are images from two different anatomy textbooks that we have in the Medical Museum from about 1850. I mentioned Chinese medicine. With a large number of Chinese, of course, building the railroad and the levees, Chinese medicine was common and also effective. There was a Chinese doctor that saved Governor Stanford's wife when she suffered a severe lung condition. No doctor available? Well, there were options. There were home health books. This was a 1925 guide. And it's very similar to guides going back to the gold rush that were written for people, particularly coming overland in the 1840s, 1850s, that included a lot of information in caring for the health of the family. And it was a woman of the household that generally was responsible for taking care of the health of the family. Here are a couple books in our collection. The Library of Health. As you can see in the cover, you can do nothing to bring the dead to life, but you can do much to save the living from death. When available, of course, the physician effect was questionable, again, because he really didn't understand the cause of diseases. Here we have another book from 1847, The Diseases of Women, Their Causes and Cure Familiarly Explained. Now, patent medicines were common in the early 1900s, but they do go back to the mid-1800s also. And this was an expose in 1905 in Collier's magazine about patent medicines. Babies who cry are fed laudanum under the name of syrup. You can see some of the ingenious names given to some of the patent medicines of the time. The sedative contained cannabis. The flatulence medication contained nuts vomica, which was obtained from the seed of the strychnine tree and therefore did contain small amounts of strychnine. Make Man tablets, which was used for treating the nervous system in men and women. And of course, my favorite, Wendel's Ambition pills. In June of 1906, Theodore Roosevelt signed into law the Food and Drug Act, also known as the Wiley Act, after its chief advocate. This name was shortened to the Food and Drug Administration, or the FDA, 3 years later. More patent medicines. The top one is a good example of a popular type of medication during the gold rush, a gift to humanity, tribe, a liniment for man, horse, and dog. This meant that people coming overland would need to only carry one tube of liniment for themselves, their horses, and their pets. Another product, patent medicine product just after 1900, Pernotis for making flesh-reducing remedy. Now, Bernard McFadden, is not a patent medicine, but his book Constipation does make a point of the fact that regularity in the early 1900s and probably into the 1800s was a very important thing for a lot of people. And here we see Captain John orderlies for constipation, biliousness, and dyspepsia. We see Harlem oil, which actually went back to 1696. Now, quackery was common in the 1800s and early 1900s, and of course, you still see it around today. This was a magneto-electric machine. You would put one finger in one of the metal tubes, another finger in the other metal tube, have someone turn the handle and generate electricity, which in theory would remedy a lot of problems. And you might want to take a stab at what these are. They're Dr. Young's Perfection rectal dilators. They were popular from 1890 to about 1940. And again, you see the importance of regularity. They're used for constipation. But as a rectal dilator, you'd be surprised that they also were used for headache, neuralgia, rheumatism, asthma, indigestion, sluggish circulation, malnutrition, and the abuse of cathartic drugs. Now, if you had a toothache back in the 1850s, 1860s, what would you do? Well, if you're fortunate, you'd go to a dentist. Dr. Pearson was a Sacramento dentist that was in practice in 1850 in Sacramento. However, if you were not fortunate enough to have access to a dentist, you had other options. Now we'll talk a little bit about disease and disorders. Some of the diseases during the gold rush and also around today, but some of the more prominent ones you read about were yellow fever, malaria, typhoid, typhus, cholera, and of course many more, including all the childhood diseases. And talking about childhood diseases, if you walk through our city cemetery, you'll see a lot of grave markers with a lamb on top of them. And of course, a lamb and a grave marker designates that there's a child buried there. Measles, of course, were common, not only miserable, but fatal for some patients. Smallpox, fortunately, we do not see anymore. It has been gone from the earth, from the entire world since 1979. So 1979 is when smallpox was claimed to have been eradicated from the world. And this was because of vaccine. The smallpox vaccine does not contain smallpox. It contains vaccinia virus, which is very similar to the cowpox virus that Jenner used in 1796. And that was the first successful vaccine, Edward Jenner's use of cowpox to prevent smallpox. During the 1770s, smallpox killed at least a third of the West Coast Native Americans, and these are 16th century Aztec drawings of victims of smallpox and measles. Another disease, a really nasty one, was diphtheria. Now, diphtheria killed people, generally children, by two ways. Number one, it produced a toxin, and the treatment for that would be to inject an antitoxin. It also killed children by forming a membrane over the trachea, which caused them to suffocate. And this was a set of larynx tubes developed in 1890 to cut through and create an airway in those patients to save them. And of course, I think most of you can guess what this was. This is a picture of downtown Sacramento in 1918 for the influenza epidemic. 675,000 people died in the United States and 90 million worldwide during that epidemic. A disease you don't hear as much about because it was more chronic rather than acute and epidemic was tuberculosis. The organism's been around for 70,000 years, infects about 2 billion people worldwide and about 10 million new cases yearly. And at the dawn of the 19th century, tuberculosis had killed 1 in 7 of all people that had ever lived. Of course, the makers of patent medicines would respond to anything, and here are some of the responses to try to cure, of course, ineffectively tuberculosis. This is an item in our museum. It's used to inject air into the chest cavity to collapse a lung. Before the days of chemotherapy for tuberculosis, collapsing a lung would let it rest and hopefully recover. There are actually 2 TB sanatoriums in our area in the 1900s at Weimar and Colfax. Now, the big 4, these I consider basically are kind of physical methods of treatment as opposed to drugs. Bleeding, of course, I think most people are familiar with. Hippocrates, over 2,000 years ago, postulated 4 humors: blood, phlegm, yellow bile, and black bile, and felt that if they were not in balance, you'd get sick. So, of course, if you had a disease he felt was too much blood as a cause, you would remove blood. And this looks like a scalpel, except it has a short blade at the tip. It's called a fleam. It was for removing blood. This is what you might consider a Swiss Army fleam, different sizes for different patients. It might even have been a veterinary fleam because bleeding was used up through around 1900 in treating animals. This is an image of a bleeding bowl that would catch the blood. These are 2 items we have in our museum, scarificators. This one had 8 blades that were spring operated and would make 8 incisions in the skin for bleeding. And this aesthetically more pleasing one had actually 12 blades that would make 12 incisions in the skin. And here's an old English image from 1804 showing the blood spurting out from an incision made in the fold of the arm into the bleeding bowl. Here's a spring lancet, again, like a fleam, but spring operated. Now you might wonder why we have a picture of George Washington when we're talking about bleeding. Well, George Washington had a severe sore throat, which he probably would not have died from, but what he did die from was frequent bleeding and acute blood loss. Of course, while we're talking about bleeding, we need to look at a barber's pole. The barber surgeons, who were particularly in England, did minor surgery and did bleeding. And in fact, the surgeons of today in England, who were called Mr. instead of Doctor, are basically evolved from the barber surgeons. And of course, the barber pole developed its appearance because the barber surgeons would hang their blood-soaked gauze outside to dry. So it was a red and white that attracted people. Of course, another way of bleeding was the use of leeches. Are they still used? Of course they are, but for a different reason, not to please Hippocrates, but they're used by plastic surgeons to save flaps or digits that are replaced by plastic surgeons, which would engulf with blood, which would compromise the work the plastic surgeon did. But the leeches would be used to remove this excess blood. As you can see, they're $15.50 each. This is an old price list from Leeches USA in New York, who produces leeches for medical clinics and hospitals throughout the United States. We have cupping. There was dry cupping and wet cupping. The dry cupping in the olden days, so to speak, would be done by putting a little piece of flannel inside the glass cup, lighting it in the fire, putting the cup on the skin, the fire would go out, create a vacuum, and create a blister. Wet cupping was basically the same, except putting the cup over an area of skin that had been incised to increase the amount of bleeding. Now, of course, cupping is still done today. Despite the recent reemergence by athletes, it's still questionable whether it's effective or not. Of course, it's been used in Chinese medicine for thousands of years with a fair amount of effectiveness. Puking and purging are self-explanatory. Puking giving the equivalent of an emetic, purging the equivalent of a laxative. So these were four modalities commonly used for treating disease during the gold rush: bleeding, cupping, puking, and purging. Now we go into medicines and medicaments. This image is from an exhibit that I did in 1990 at the Sacramento History Museum, then known as the Discovery Museum. It was a 5-month exhibit, and I curated that exhibit. Common medicaments: arsenic, strychnine, mercury, and narcotics. This bottle of medicine, which is probably for heart patients, included digitalis, nitroglycerin, and strychnine. Another one, judging by the way it's bottled, probably from the very early 1900s, still contained arsenic and strychnine. We have a variety of sedatives. You can see 2 of them contain morphine or laudanum, and this one, in addition to morphine, contained cannabis. In a lot of the diaries of the trail, you will read about the use of cayenne or red pepper and mustard plasters by patients coming overland. This would be a little example of the pills that a doctor would carry with them on house calls back in the 1800s. Now we'll get into the gold rush area. The trek to California was tough. It generally involved seeing the elephant or treading the elephant's tail, both expressions meaning one had gained experience by undergoing hardship. Excuse me. It was estimated the overall mortality of those heading west was 6%, and those who survived the long trek not infrequently arrived to find that death was not far behind them. The most common medical problems of the immigrants included gastrointestinal illnesses, from chronic complaints to diarrhea, dysenteries, and diseases such as cholera and typhoid, and medicines with little or no benefit. There's a 6% mortality for the people coming overland to seek gold. Here we have a variety of things that I'm sure were ineffective, but they did make money for the producers. Cholera morbus cure, treatment for typhoid fever, pills for chosen fevers and all malarial diseases, and Dr. Shoup's diphtheria remedy. When one looks at the quality of drinking water as noted in the following journal descriptions, it's no wonder that gastrointestinal problems were so common. Once we came to a puddle where rainwater had been standing till green on top and so muddy that if there had been a hog about, I should have sat down as one of their wallowing places. Yet this stuff, which would have been rejected very suddenly by my stomach at home, I drank with considerable relish by shutting my eyes and holding my breath. This is what is called seeing one of the elephant's tracks. And another vivid description of the water, and I think my favorite. Our drinking water is living. That is, it is composed of 1/3 green fine moss, 1/3 polywogs, and 1/3 embryo mosquitoes, and these we strain through the teeth. Another major problem occurred in those who did not bring citrus or utilize fresh vegetation. That was scurvy or vitamin C deficiency, which also claimed numerous lives. Another graphic description from a journal reads, I was much surprised today with indications of the scurvy, pain in the ankles and legs, and sores breaking out in my hands, and bleeding of my gums when polishing my teeth. God grant it may not be, for I have suffered enough already, I think. Another quote reads, the amount of suffering in the latter part of the route was almost incalculable. I saw men sitting or lying by the roadside, sick with fevers or crippled by scurvy, begging of the passerby to lend them some assistance. But no one could do it. Consequently, they were left to a slow, lingering death in the wilderness. Now, here we see some of the early tools of the physician. Of course, ether did not come around till 1846, and antisepsis until 1865, which made surgery pretty rough back in that era. Chloroform was also used. Chloroform, however, had harder cardiac complications. It was safer because ether was very flammable, and you could not use chloroform if there were an open flame around. This is an amputation saw. You can see the black wooden handle, which being indicative that this was developed before the days of belief in sterilizing instruments. Looks like an old meat saw, and I don't think there was a lot of difference. The need for amputation was frequent, a procedure going back centuries. If a fracture penetrated the skin, the mortality rate was about 100% due to infection, whereas the mortality rate of amputation was only 50%. So 1 out of 2 patients were saved by amputation, which was the most common operation at the time. And here you will see a Hayes bone saw used to cut in the skull, a tree fine and the handle for the tree fine. The tree fine was used to burrow a round hole or plug in the skull to relieve blood that might be pressing in the brain from an injury. The lower layer below this contains a whole variety of amputation knives. Now I'll read the description of the attempted amputation of the crushed leg of a child by a wagon train member who had no medical background. The instruments to be used were a common butcher knife, a carpenter's handsaw, and a shoemaker's awl to take up the arteries. The man commences sawing, but before he had completed the amputation of the bone, he concluded that the operation should be performed above the knee. During these demonstrations, the boy never uttered a groan or complaint, but I saw that he was dying. The operator, without noticing this, proceeded to sever the leg above the knee. A cord was drawn around the limb so tight that it cut through the skin into the flesh. The knife and saw were then applied and the limb amputated. But death from drowning was a hazard at numerous river fords. Trauma also occurred through attacks of immigrants upon each other, and medical care at times would be provided by medical posts and immigrants abandoned along the trail because of illness, and they were sometimes brought in by the military to help them recover. And all these immigrants were coming, again, you've seen this before, to one of the most healthful territories on the continent with a climate unrivaled in purity and equability, nor is sickness that scourge of humanity here to harass and hinder us in our pursuits. And all these immigrants were coming to a land described as one of the most healthful territories in the continent with a climate unrivaled in purity and equability. However, it did not remain that way. As the population of Sacramento suddenly jumped from 2,000 to 10,000, and 250,000 people poured into California, the immigrants exceeded the facilities. Sanitation was a luxury, and the 49ers lived primarily in tent cities, squalid cabins and shacks where human sewage polluted the streams. Few who worked in the mines ever carried home their prior state of good health. It only got worse. The floods of January 1850 brought typhoid, encephalitis, diarrhea, malnutrition, and other disorders, complicated by the arrival later that year of cholera. It was said the physicians did noble work. No danger appalled them. Night and day they responded to the call of distress, scarcely pausing to snatch a few hours of needed sleep and rest. Now we'll take a closer look into one of the three perils of the 1800s. Sacramento was repeatedly decimated by floods, fire, and disease, but it always rebounded. We'll now look at the reason behind many of the 19th century deaths and many of the mass burials, a disease not known in California today, but still common in other parts of the world. Let's go back 170 years to the gold rush. Population of Sacramento, about 8,000, about 50 doctors in the recently formed society. According to the New York Journal of Medicine, over the prior 6 months, 90,000 people arrived in California. 15,000 a month, about 4,000 a week. 30,000 of these came by sea, a voyage of 17,000 miles. The other 60,000 crossing arid plains and rugged mountains. It was said death was not a stranger. It was estimated that 1/5 found graves within the first 6 months after arrival. So if you add the 25% to the 6% that died en route, it meant only 3 out of 4 people arriving in California were still alive after 6 months. On October 1850, a ship, the New World, arrived on the Sacramento waterfront carrying news of California's statehood. There was no sanitation or clean drinking water in Sacramento. Mounds of garbage, human and animal waste, dead animals, and all manner of trash accumulated behind Sacramento's tent dwellings, boarding houses, gaming parlors, stores, and food establishments. The stage was set for an epidemic. All it would take was one victim to arrive and set it off. And there was a victim dying in the levee after disembarking from the New World. He sparked an epidemic that caused panic, total panic in Sacramento. This was cholera. Let's take a look at a medical textbook of the mid-1800s to understand the inherent terror it produced. This disease generally commences with vertigo, headache, and singing in the ears, a sensation of flatulence in the stomach, or gripping pains, and a feeling of weight and oppression in the region of the heart. We find the lips, nails, and sometimes the whole skin of a blue color. The frame loses its power of generating heat. The pulse and pulsation of the heart are almost unfelt. The attack of the disease in extreme cases is so sudden that from a state of apparent good health, with a feeling only of a trifling ailment, an individual sustains as rapid a loss of bodily power as if he were suddenly struck down or placed under the immediate effects of some poison. The countenance assuming a death-like appearance, the skin becoming cold and giving to some the sensation of coldness and moisture and touching a frog, to others the coldness of the skin of a person already dead. The eyes are sunk in their sockets, the tongue is cold and either clean or covered with a slight white fur. You can see by this description this was indeed a disease to be feared. Well, during the epidemic, thousands, estimated 4/5 of the population of Sacramento, left the city carrying the disease into the foothills, but also abandoning those afflicted, including their relatives, to die alone. A Sacramento reporter for Alta, November 4th, 1850, wrote, "This city presents an aspect which is truly terrible. 3 of the largest gambling halls are closed. You knew there was trouble in River City when that happened. The streets are deserted and frequented only by the hearse. Nearly all business was at a standstill. There seems to be a deep sense of expectancy mingled with fear pervading all classes. There's an expression of anxiety in every eye, and all sense of pecuniary loss is merged in a greater apprehension of personal danger. Many deaths are concealed and many not reported." At the worst, more than 40 deaths per day occurred, a mortality rate of about 1% of the population daily. Within 18 days, about 1,000 died, an estimated 15% of the population. The typical statistic for the time, and often death, occurred within 24 hours of onset. It's estimated that up to 5,000 people may have died throughout Northern California from the simple epidemic. The physicians all remained caring for their patients, and they also died. Dr. John Morse wrote, "The rapid spreading of the epidemic gave to the physicians no rest day or night. They were falling like the foremost soldiers of a desperate charge, and ere this cholera season had subsided, 17 of their number were deposited in Sand Hill Cemetery of our city, an inroad of death from which a fraction of 2 in 3 escaped with life, and not 1 in 3 escaped from the disease. And yet not one educated physician, referring to the true MDs, turned his back upon the city in its distress and threatened destruction." Dr. Thomas Logan, a pioneer physician who served during the epidemic, stated, "No monument of marble records their heroic deeds, but their memory shall remain in the pages of history and medicine of California, an imperishable legacy to the profession they have ennobled and adorned." Dr. Logan was very talented. He was quite a painter. He painted this image in 1855 for the state agricultural exhibit, which was a forerunner of the state fair. And he wrote the first medical history of California in 1868, published in 1869. These are the names of the 17 physicians out of the 50 estimated to be in Sacramento at that time that died from cholera, taking care of their patients. And we're not sure where they're buried in the cemetery. We only know where one is, and that's the grave marker you see to the right for Dr. Pliny Green, who is buried in the Pioneer Grove in the city cemetery. While cholera was ascribed to various causes, including effluvial emanations or miasma. Miasma was a bad air coming off the swamps. Others blamed unwholesome food, damp weather, wet feet, and suppression of perspiration for cholera. And still others blame something that sounds like was common during the gold rush, and it was eating indigestible foods and drinking cheap champagne. And of course, treatment was non-existent. A city board of health was formed 12 years later in response to a smallpox epidemic. It established an effective quarantine and a pest house, which was an isolation hospital for the homeless. And it had great benefit diminishing the damage caused by smallpox. Even though not formed until 1862, the City Board of Health of Sacramento had the distinction of being only the second such organization in the United States. It's often said that we learn by history. History may keep us from repeating mistakes. Let's take a look at a comment on the cholera epidemic by Dr. John Morse, and let's ensure similar text is not written about our era. In 6 days from the time of its inception, it was making such progress that regular burials were but slightly attended to, and nursing and attention were not infrequently overlooked. Money could scarcely buy the offices of human kindness, and affections were so neutralized by the conflicting element of selfishness that but little could be done to arrest the course of the disease. Malaria was also a prevalent disease throughout the summer of 1849. Scurvy, diarrhea, dysentery, typhoid, rheumatism, erysipelas, pneumonia, mental diseases, and more, plus the epidemic of cholera, came with immigration. Again, we reflect back. Within a few short months, the gold rush immigration produced a collecting point of health tragedy not to be equaled any other place in the world. And remember, just months before the migration, it was one of the most healthful territories on the continent. Beyond epidemics, the mid-1800s were also marked by marvelous men of medicine, dedicated, hardworking, civically oriented men. Here's a list of the ones in the 1850s, primarily in Sacramento. We have Dr. Harkness, and you can see Dr. Harkness School that is named after him. Dr. Nixon, who was a prominent railroad physician. We had 3 railroad hospitals in Sacramento taking care of railroad employees in the 1800s and early 1900s. And others, including Dr. Nichols, Dr. Simmons, and many others. And of course, Dr. John Morse wrote the first history of Sacramento in 1853, a phenomenal book to read. And this history is a colorful excerpt describing the medical condition of a patient rescued from a hospital as invading floodwaters moved into Sacramento. This book is available in the gift shop at the Sacramento History Museum. I believe they have 4 in stock now, but they will be getting additional stock in the next week or so. So Dr. Morris goes on to write, from a miserable canvas building in K Street between 2nd and 3rd, called a hospital, the most dreadful representatives of a worse than heartless neglect were rescued from the invading waters and thrust into the above frame hospital on the opposite corner. 3 were brought at one boatload, rolled up in the blankets in which they had been lying, no one could tell how long, but certainly in a condition too horrible to be seen and too awful to meet a faithful description. One of them, whose blanket enveloped the entire body and head, seemed to be rapidly dying, and consequently, he was the first to get the attention of the physicians and nurses. An attempt was made to unroll the blanket, but it was found to be so adherent to many parts of the body as to make it difficult removal. So difficult that the effort was delayed after the face was relieved for the deplorable victim to revive, if possible, or if not, the death might free him from a sense of his situation. Fortunately for him, death was a speedy alternative. His troubles were ended. A finely developed form, a face in which lingered the indices of cultivated intellect, a heart that once beat with manly pride, were enwrapped in a death so dreadful as to beggar description, and so appalling as to excite an almost eternal impression of nausea and disgust in the minds of those who beheld it. The blanket was with difficulty detached, and when drawn off presented a shirtless body, partially devoured by an immense bed of maggots occupying nearly as much space as the emaciated carcass itself. And when one adds to this loathsome mass these crawling elements of disgust, the accumulated excretions, which were alike confined by the agglutinated folds of the blanket, a head of hair almost clogged up with vermin, then can a just conception be formed of what was suffered during the sickness of the fall and winter of 1849. So what about maggots? Maggots leeches were commonly used in the 1800s. Of course, leeches were used to fulfill the hypothesis by 2,000-year-old Hippocrates by removing blood, which did nothing of benefit. Today, leeches are used by plastic surgeons for a definite benefit. Maggots were not used as such during the gold rush, but because they are fly larvae, anyone with an open wound walking around may have a good chance of developing maggots. And maggots then, as they do today, do the same thing. they clean wounds. They have little mouth parts that eat dead tissue. They have enzymes that dissolve dead tissue. They do no harm to living tissue. And they will clean a dirty, grungy looking ulcer better than any modern medicine we have today. And again, you can see, like in leeches, which you can purchase today, you can also buy maggots, or physicians at least can, $190 a vial. And they're used in the hospital to clean ulcers that are not amenable to any other treatment. But despite the loss of 17 dedicated physicians from cholera, medical care in Sacramento did go on. Dr. Morrison Stillman had a hospital they opened in 1849 at K and 3rd Street. Pharmacies were very prolific. X-rays were discovered in 1895, and by 1897, Dr. Fay in Sacramento had the first X-ray unit. Well, we've come a long way. A long, long way. Rather than treating the patient as was done in the 1800s, we treat the disease, less personal, to a much more effective method of practicing medicine. Looking at the advancements in the past 10 or 20 years compared to the past 170 years, one can hardly imagine what advancements may occur in the next 50 years.
All right. Well, thank you so much, everyone who joined us. Thank you again, Dr. Bob. This was fantastic. And then I hope we'll see you all again next week when we will have a virtual tour of the Medical History Museum.
Very good. Thanks for the opportunity.
Thank you so much. We'll see you next week.
Thanks. Bye-bye.
Bye.